Health officials say that Philadelphia is not getting its promised allotment of monkeypox vaccine from federal health officials, which is certainly raising concerns.
Yeah, we're just learning this information. Let's get right to CBS 3 health reporter Stephanie Stahl, who just spoke with the health commissioner.
That's right, just minutes ago. Dr. Bedegal tells me the city was expecting to receive up to 3,600 vials of the vaccine, but they have just learned they are now only getting 720, which means far fewer Philadelphians will be protected.
I'm worried, and I also feel really bad because just a couple of days ago I met with community groups and talked about how excited we were to have much more vaccine with this new approach.
Do you think that the federal government is mishandling this?
You know, I think the federal government has a very difficult job right now. So it's not that I'm looking to critique the federal government, but I do feel like it's really important for Philadelphia right now, while this outbreak is still relatively early, to have as many doses as we possibly can have of this vaccine.
Now, the Philadelphia Health Commissioner is one of many expressing concerns about the monkeypox vaccine distribution issues. Senator Cory Booker says New Jersey is also not getting its fair share of monkeypox vaccine. In a letter to the Department of Health and Human Services, Booker says testing and vaccine needs to be increased, given, quote, the disproportionate risk that the state faces.
There are now close to 12,000 monkeypox cases in the United States. CDC case trends show a sharp escalation. Locally, Pennsylvania now has 336 cases, New Jersey 335, and Delaware with 10. In the city of Philadelphia, monkeypox numbers are also rapidly increasing. Last week, there were 128 cases. Now there are 198. That is a 55% increase. Federal health officials say they are providing additional monkeypox vaccine earlier than originally planned, an extra 442,000 doses. But there are complaints from local providers that the distribution system isn't working well.
Demand for vaccination is immense.
There are also growing concerns about stretching supplies by allowing providers to use one vaccine vial for 5 injections using a different injection method.
This will increase the total number of doses available for use by up to 5-fold.
The maker of the monkeypox vaccine expressed reservations about the new plan, citing lack of safety data. But the FDA commissioner defended the agency's decision, saying the new dosing regimen resulted in some side effects, but they were manageable.
I really do wish that the Biden administration and our government in general took it more seriously.
Also, the first suspected case of monkeypox being spread from humans to a dog in Paris is being reported by The Lancet, leading the CDC to update its website to include dogs among animals susceptible to catching the virus. It is still mainly being spread by prolonged personal contact among gay men. Now, with animals, the CDC says monkeypox can also be spread from pets to humans. With the case I just told you about in France, the report says the dog may have been infected while sharing a bed with his owners who had monkeypox. So lots of developments, lots of fronts here. We'll be following all of it for you.
All right, thank you so much. Appreciate that, Steph.